Well, Paul, thank you very much for that introduction of the governors here and for some of that history on how Operation Warp Speed got going. You know, it's always, if you're a leader in business, if you're a CEO of a cabinet department, you know it's all about the people. People is policy. And you've gotten to see today some of the incredible people who have driven this to make this work and get these. I think, Paul, you had a really nice quote from Churchill. It's the people who allowed us to unlearn what was impossible. And folks like Dr. Moncef Slaoui leading on the development, General Gus Perna. When I talked to Secretary Esper and the chairman of the Joint Chiefs, they immediately said, oh, we got the guy for you. Had an Army Materiel Command and said, Gus is the guy for you. Got to be there. And I called around and I said, you know, I need manufacturing. And Carla Di Natale Stefani, a real talent we don't mention as much, who led global manufacturing for all of Bristol Myers Squibb, a biologic manufacturing company branded around the world, but also for Teva, one of the world's great generic companies, able to stand up 200 assembly lines and manufacturing processes per year. So that kind of talent, they dropped everything. These folks dropped everything that they were doing. General Perna moved, gave up his command, moved. These others volunteered. They gave up their retirements. They stopped their retirements. They came and they served the country just in the greatest spirit of what people did in World War II, what people did with the Manhattan Project, what people did with the Apollo Project. And I just want to express my public appreciation to the people who really are making this happen. And I want to also express my appreciation to the folks on the stage with me here. You know, under the Vice President's leadership, we have had an intimate and close connection to America's governors. Almost every single week, we have had a often multi-hour video conference with our nation's governors, our territorial governors, and it's really been one of the great collaborations I've ever seen. We are over 40 at this point, I know, of the gatherings that we have already had this year. And the four governors on the stage here, I don't think there's been a weekly session that the Vice President hasn't called on each of you to share your learnings, your understanding, and your expertise with your fellow governors. And there's a reason for that. As we talk, as Paul said, about the three key partnerships that are part of Operation Warp Speed, one of them is the federal-state partnership. And just on vaccine distribution planning, these four governors put together some of the best vaccine distribution plans, the real models for the rest of the country. And that's why we asked Governor Edwards, Governor DeSantis, Governor Abbott, Governor Lee to be here with us. But I just want to say, beyond vaccine planning, just throughout this entire pandemic, they've been incredible partners to work with on a bipartisan basis. It's been really an honor to work with each of you, so thank you for that. I want to kick things off. As I mentioned, there's a reason we asked you, in addition to your general expertise and leadership, but it was that the CDC looked at your plans and said your plans really are exceptional. Let me ask first, Governor Abbott, do you mind sharing with us any insights about the process you used to come up with your plan? And I'll turn to the other governors real quick just to get any insight there.
Sure. Well first, thanks to you and thanks to everybody in the Trump administration for this Operation Warp Speed. It really is a feat of medical advancement. But as you know, we've been working collaboratively with you, with your team, and with the White House coronavirus team to get us prepared. So we began preparing for the delivery of these vaccines going all the way back to the spring. And we have accelerated that over the past month or two. And over the past month, we have already signed up more than 7,200 providers in the state of Texas that are awaiting for these vaccines as we speak right now, ready to make sure that we do put needles in arms within 24 to 48 hours as soon as we get those vaccines. The providers that are signed up include hospitals and private health care providers, nursing homes, local pharmacies, and these large pharmacy chains. Importantly, working with your entire team, learning the strategy and information that we need, we were able to set up a large number of these cold change storage operations so that we would make sure that we would be able to handle the Pfizer vaccine as well as the Moderna vaccine adequately. Also, to be ready for this, we understand when we're doing something this large, especially in a state the size of Texas, we needed to make sure that we were able to work out the kinks, and to do that, we actually ran several mock distributions in advance to make sure that when it does arrive, we will have eliminated any of the potential missteps. And then, very important, we have established ways that we are going to remain in communication with the people who receive the first vaccine. This includes when they do first receive their vaccine, they will be receiving a reminder card at that time, letting them know when they are to return, where they are to return, and the process about returning for the second vaccine. But we know that may not be enough. And so on top of that, we will be following up with text messages, with phone calls, with email reminders, and with a statewide communication plan to make sure there is an inescapable way for people to make sure that they're going to be learning about exactly what they need to do to make sure that they get that second dose to make sure that they are fully vaccinated.
Governor, one quick aside, you mentioned the vaccine reminder cards, and this is coming up a lot lately. We've talked about myths earlier today. That's not a national vaccine card, right? That's like when you go to the dentist and you get a reminder card saying, come back in 6 months and here's your appointment, right?
Well, and that's true. I'm going to take it a step further because of the unique attributes of Texas. There is no national vaccine card, and we're not creating a national database or anything like that. But as Texans know, in the state of Texas, people cannot be required to take a vaccine. Most people want to, and there's going to be such a high demand for it that all of the supply will be used up. But I just want to make sure my fellow Texans know that we know that you are not going to be forced to take a vaccine against your will.
Great. Thanks, Governor. Governor Edwards, you mind telling us a little bit about how Louisiana and you came up with your game plan?
Yes, sir. So we got started in the spring as well, and I'll tell you that by June we created a vaccination action collaborative, and we have 73 members, 36 different organizations, public and private, higher education involved, and we created 4 work groups. They've been meeting every week since then, and every one of those work groups has a health equity interest that has been attached to it. The National Guard has been attached to it, and they've been working nonstop because we want to make sure that we have a way to do this that is equitable, but also we want to be organized in the way that we receive and distribute and actually administer these vaccines. And so we've involved LSU. They have the National Center for Biomedical Research and Training. They've run 2 tabletop exercises for us. Each one has been instructive because we realized we had some gaps that we needed to fill. We similarly had some distribution exercises to make sure that the hospitals, for example, would know what to expect, and hopefully in the next number of days they're going to actually be going through that. We've got a memorandum of agreement. The public-private partnerships are done at the state level too. So we have an exceptional pharmaceutical wholesaler in Louisiana and Shreveport area. We have a memorandum of agreement with them, and we've identified in advance all of these issues that we expect to have. And just like we've heard from Walgreens and CVS and UPS and FedEx and McKesson, states, we've been in the business of doing this for a long time too. So it's not anything new. It's just at a scale that we don't typically have to do it at, right? And so we have some really good professionals in the Office of Public Health in Louisiana working across the state with all these different groups. And we want to promote the confidence of the people of Louisiana that this is going to be a safe and effective vaccination that they're going to want to have. And so you've got to have a good plan in order to, I think, foster that confidence.
Thank you, Governor. Governor DeSantis?
Yeah, sure. Well, first of all, this is, I would always tell my folks, we hope we get a vaccine, but you should definitely not count on it because it's ambitious. It hasn't happened before. So the fact that it is, that's a great testament to Operation Warp Speed and all the work that so many people have done. So we couldn't, as soon as the Pfizer news came out, I flew up and met with you on Warp Speed, and I told my folks, we already been planning for it, but I was like, we got a better sense of the timeline. Let's make sure that we're leading from the front. We really wanted to embrace this. I know other governors have said this may not be good. We view it as a good thing, not forced for anybody, but offered to all. And we basically did our vaccine plan to flow out of our normal mitigation plan in terms of we focused on protecting vulnerable populations, whether it's in nursing homes or the broader senior population. We focused on supporting our healthcare system, and then we focused on making sure kids were in school, people were able to earn a living. And if you look at what we can do with nursing homes, we could have every resident of nursing home and long-term care facility vaccinated in the month of December. I mean, that's within our grasp right now in the United States. In the state of Florida, we have 4,000 facilities. We're working with CVS, Walgreens to be able to do that. It's important for saving lives because they're the most vulnerable, but most of them who get it do survive, and then many obviously have not been infected. But it has such a devastating effect to have mitigations going on in these. Look, we allow visitors, but you have to take all these precautions. You just can't live normally. And it's taking a huge toll on these folks. And so we see loneliness, despair, even with having some visitation. So we need to get them back to normal. And getting them back to normal is going to mean so much to those residents and their families, and I'm thrilled that we're really on the doorstep there. And then in terms of the healthcare system, look, the models that said that we're not going to have beds, tens of millions of hospitalizations, obviously those were very, very wrong. But what we found, particularly over the summer when we had a higher census, was it wasn't that we had plenty of beds. But, this is very labor intensive for healthcare staff with the isolation procedures, everything they've got to do. Obviously, they're testing everyone that comes in, so if someone breaks their legs, they may be asymptomatic, but you still got to do the procedures. And then an exposure could take out a half a dozen nurses at one time. Well, to be able to get it through, offer it to our healthcare systems, their tip of the spear, high contact workers, to be able to have them, well, they're going to be in a situation where they're going to be able to handle patient load going forward. And so I think in terms of the most at-risk population, we'll be able to target first, and then simultaneously the kind of the high contact, which would have the most impact on our healthcare system. And then we think, based on the numbers, at the end of December, we can start getting it out into the broader senior population, and then January really focus on vaccinating as many elderly people as we can. And so we're really excited about it. We really leaned into it, and then we thank everyone for doing it. This is a really, really significant achievement for our country.
Just imagine that every senior in a nursing home in Florida within the next several weeks getting protection. That is something. Wow. Well, Governor Lee, the Vice President and Dr. Redfield and I came down to visit you and our great partners FedEx just last week. Do you mind telling us a bit about the great process you all used?
Yeah, we are proud of FedEx and the role that they're playing. Proud of Vanderbilt as well, the role that they're playing nationally in this process. So Tennessee is, we're excited to be on the forefront here. I want to commend your team too. Many of them that we have been on phone calls. You talked about the multiple phone calls we had. One of the benefits of that is the interaction that we've had with the governor. So many of the things that you're hearing right now, we're all doing in different ways. And part of the reason is because we've been talking about the things we're going to do because of the coordinated effort of the coronavirus task force. It's been a part of the reason why I think the approach from this administration has been so effective. It's allowed us to get best practices. But so Tennessee started several years ago with pandemic immunization preparedness by pulling up something we call Fight Flu TN, and we do once a year a broad immunization day across the state where we vaccinate thousands of people in every one of our 95 counties. And that process gave us a blueprint for how to do what it is that we're going to be doing in the next few weeks. Because our public health officials, because of the Fight Flu TN process, our public health officials had practice in and the logistics of this and the communications of how it is that we get it out to folks. So we've taken that blueprint, recognizing that this is much bigger, pulled together stakeholders, groups that really advocate for Tennesseans, because we want to make sure this gets distributed equitably. And in order to do that, we brought in advocates for those with disabilities, AARP, our pharmacy companies, 30 different organizations to help us develop a priority population strategy that will include the most vulnerable in nursing homes, our healthcare providers and staff, for all the obvious reasons of making sure we have capacity in our healthcare system and protect the most vulnerable. And a lot of that strategy has come through the infrastructure that Tennessee built in the very beginning to address this, with a commitment to testing, free testing for every person in Tennessee, regardless of symptoms from the very beginning, a commitment to partnerships with our healthcare providers, and then a commitment to developing a real strategy for this vaccine implementation. So for a few years, we've been preparing for it. We have escalated that preparation this year. Really, again, federally, you all have done an unimaginable job of bringing this to the states. Now it's our turn to do what needs to be done to get it out to, in our case, the millions of Tennesseans that will have the choice to take this. We want to communicate it in a way that they are fully informed, so they can make a choice, and that they understand the safety and the efficacy and the certainty with which we think this has been delivered.
Thank you, Governor. So next one, let's do rapid fire around here. I want to ask each of you, because it's a question I get on TV all the time, is on speed. Just how quickly do you think you can get 100,000 people vaccinated in your state? Governor Lee, you want to kick us off?
So the director of our health department, Dr. Lisa Piercy, is here. She probably could answer that, but I'm going to say, Dr. Piercy, that we can do it in 24 to 48 hours.
Yes, sir. Wow. Governor Abbott?
Same thing. Listen, we're ready to go. All we need are the tests and the vaccines, and once we get them, they should be done within 24 to 48 hours.
Governor DeSantis?
Yeah, we hope so. I mean, I would need to ask for sure, but I think the hospitals, it was great because I talked to them, and they were like, look, this is easier than doing the diagnostic test. We do this all the time. We do shots. So I think they're going to be able to get their workforce done very quickly. And what we did was we picked a certain number of hospitals that are huge, but we said, look, we want all the other systems. And so they're like, oh, absolutely. So they're all working together, and I think they're going to be able to deliver it, pretty expeditiously, because they know. And the first shot, it has protection from what we're hearing. That's a huge deal, and that's really great.
Governor Edwards?
Well, assuming that we're on track with the emergency use authorization and so forth, we expect 39,000 doses of Pfizer the first week, about 40,000 the second week. So let me just tell you, within 48 hours of getting that second allocation, we will have administered those vaccinations with shots in the arm with medical personnel, not just doctors, nurses, and therapists, for sure them, but also people who clean the rooms, who deliver the food, anybody who directly or indirectly can be exposed to the virus and contract the disease in those hospital settings, including our EMS workers, by the way. So we're going to get it done within 48 hours.
And that last point Governor Edwards mentioned, I wanted to stress that a lot of times we use a term, because we're in a healthcare world, we use a shorthand of healthcare providers. What we really mean are healthcare workers. And so as important as doctors and nurses, it's the janitors, it's the orderlies, it's the aides, everybody who are providing that kind of help that make the system in the hospital, the nursing home, what have you, work, and are just as important, if not more often, than everybody else to make sure they get protection also.
Yes, sir, exactly.
Yeah. Along those lines, I wanted to raise the question of, we have, of course, advice out of the CDC and the Advisory Committee on Immunization Practices, but you all as governors have the freedom to decide how you'd like to prioritize. One of the key areas that I think we all worry about are the individuals who are underserved in our healthcare system, who may not have a lot of connection to it, may not have the frequency of interaction of others. as you've been thinking about your vaccine distribution plans, maybe Governor Edwards, if you might kick us off here, how are you thinking about reaching the more underserved in our community who, in many instances, have borne a very disproportionate burden of severe consequence from this pandemic?
Yeah, well, first of all, that's a great question. And we realized in April, by the way, that although African Americans are about 32% of our state's population, at that time 70% of COVID deaths were among African Americans. So I created a health equity task force that then folded on top of the vaccination action collaborative that I talked about. But we have a head start on these things because, like Governor Lee was talking about, every year we do mass vaccination exercises around the flu vaccine. And we specifically target those underserved areas to try to promote flu vaccinations. This year we've been especially successful, 42% more than last year. And of course, part of that has to do with our outreach around COVID too. We don't want flu patients any more than we want COVID patients in the hospital right now. And so that has been successful. So we've been learning lessons about how to get into these communities. But in addition to that, as part of our overall program, we have contracted with strike teams to go into specific zip codes. Just like we targeted certain areas that we knew needed to be tested, we're targeting certain areas that we know we're going to have to go in there with strike teams to administer these vaccinations. And so we have some that are commercial, but we also have stood up the National Guard. And by the way, I want to thank the administration for the extension of the Title 32 on the National Guard, because they're doing thousands of tests every day in Louisiana, but they're also a big part of our vaccination program with distribution and these strike teams that we're talking about. So with all of that, and I think we're going to get to this later, it's the underserved communities that we really need to do the most outreach to and communication with, to build up the confidence in the safety and efficacy of the vaccines as well. And so that's a big part of reaching the underserved, because we don't just want the vaccine, we wanted the vaccination. And so that's what we're working on.
Dr. DeSantis?
Yeah, I think communication is important, and I know a lot of our hospitals are already planning on doing a lot of very robust outreach, but this was the first vaccine that's really been politicized, unfortunately. I mean, you guys remember the campaign, and that's going to be something that people are going to have to deal with, and we obviously want to deal with it. I think the fact that we're not threatening to mandate it helps, because we say, look, we think it's important, but obviously you make the decision. But and then I also think just some of the bad messaging that's come out over the course of this, quite frankly, is problematic. I mean, when people are doing some of these shutdowns that are totally unscientific about this type of activity, or being on a playground, or schools can't be open, then I think people look at that. So I hope we can kind of get on the same page here, take the politics out of it, be very consistent, be evidence-based on it, and I think people will respond positively.
Governor Abbott?
Sure. So part of the job is to first identify the location of the underserved communities. And in a state as large and diverse as the state of Texas, that's a daunting task, because some of the underserved community would be in our large urban areas. Some of it would be in the sparsely populated rural areas. Some of our rural areas, out of our 254 counties, there are some that don't have access to any medical health care whatsoever. And so we have to first identify them, then go to them. And the way that we are going to them is we have put together a bunch of mobile medical units that will be taking the vaccines to the people where they are in underserved communities, to make sure that they will have access to these vaccines also. And we'll be making clear exactly one thing that Governor Lee pointed out, and that is the importance that they know that these vaccines are free. It's not going to come with any money in your pocket, thanks in large part, or thanks in total part, to Operation Warp Speed of what y'all have done here. So thank you for doing that.
Thank you. Governor Lee?
We used our Office of Minority Health and Disparities Elimination. That is an office within our Department of Health, and we use that office to really advise us on testing, because what we found early on was that our minority populations, our ethnic populations, were not, the uptake in testing was not as it should be. So we tasked that group with really developing relationships to enhance our testing for those underserved populations. We utilized relationships with our housing development agencies in our urban centers, migrant working farming communities that are a part of the agricultural process in the state. We worked with African American churches, Hispanic churches. We utilized public service announcements on Spanish-speaking radio stations. So we worked really hard to make sure that those communities and those underserved populations were hearing from those that they trust about that testing population. That is the same group now that we have developed those relationships, and we've been very grateful for, in particular, for example, the way the African American leadership has embraced Operation Warp Speed and has communicated that. Meharry Medical College, it's a nationally recognized HBCU that has worked with us to communicate with the African American community to talk about the safety of this vaccine, the importance of this population, and the uptake of the vaccine. So really it has been a continued effort from the first understanding that the barriers and the access to health care were eliminating or limiting the amount of testing. We used that knowledge. And by the way, frankly, one of the things we learned is it matters who delivers the message. Very powerfully matters who delivers the message. Not just to that community, but to every community across the state. So attaching the trusted voices in whatever community we're serving is going to be really important.
Great. Thank you very much. And, Governor DeSantis, I know we're going to have to wrap soon because the Vice President's going to be arriving, but do you mind giving us the last word on how you're thinking about prioritization, how you're thinking about which groups you try to stack as we roll vaccines out?
Yeah, so I mean, obviously, we're prioritizing long-term care residents and staff, and then tip of the spear healthcare workers. As we get past that, which we think we can do with the first a couple weeks of doses that were allocated, get into the broader senior population. We have obviously a lot in that regard in Florida, so that would really take us in through the end of January. And then we're hoping the J&J comes online with the 1 dose. They're producing it at such a scale. Then we get that out so teachers can get it, law enforcement can get it, and really, I mean, hopefully we'd have enough for whoever wants to do it. So that's our hope. But the Moderna and the Pfizer, we think based on our allocations, we're going to be focusing that on high-risk populations and the frontline healthcare workers.
Well, I hope you've seen from this panel just how deeply engaged our nation's governors are in this process. The level of sophistication, understanding, depth of knowledge, amount of planning that they have done. I think every one of you said since the spring, since the spring, been planning on this. And these 4 governors, while some of the great governors, are representative of our nation's governors and the work that's going on in every state and territory. So we really appreciate their work and their partnership throughout this pandemic. And we look forward to the weeks ahead when you're going to be getting shots in arms. So thank you very much. Let's give a round of applause.
Thank you.
Will Dupree once again here in the KXAN live studio. That was 4 governors here in the U.S. talking about different aspects of the COVID-19 vaccine planning and distribution. Particularly there, we want to point out that Texas Governor Greg Abbott participated. He was saying that when it came to talking about serving and getting vaccinations and shots to underserved communities, and he mentioned, because Texas is such a big state, that can mean very different things, whether it's a rural area without access to many healthcare facilities or an urban area where economic circumstances might hinder somebody from being able to seek the healthcare system. He had mentioned they were going to send mobile units with the COVID-19 vaccine and make it available to people, and he pointed out that there will not be a requirement to get the COVID-19 vaccine here in Texas. He stressed that and kind of made a joke of it at one point, just to reiterate to people that will not be a requirement here in our state. We will continue to follow the latest developments on this particular issue. I will say that the Democratic congressman from Austin, Lloyd Doggett, is wanting to do an interview to talk about the governor's appearance at this White House COVID-19 vaccine summit. So we were going to be able to talk to him in just a little bit. I'll tell you all that that will be featured in one of our evening newscasts, so please pay attention to that. We also got information just a few minutes ago, and I want to pull this up so that we all can see it really quickly. If you'll just give me 1 second, an alert went out. We sent out a push to anybody who's downloaded the KXAN News app on their smartphone. They'll be able to get this, but we just got information, and let me pop this up really quickly. As you can see right here on our website, the Supreme Court has rejected a Republican bid to halt President-elect Joe Biden's Pennsylvania win. This is coming in from the Associated Press. This announcement from the Supreme Court coming just a few minutes ago. This is breaking news there. The Supreme Court has rejected the Republicans' last gasp bid to reverse Pennsylvania's certification of President-elect Joe Biden's victory in that electoral battleground. You can read this article right now over on our website, so I'll direct you there. Thanks again for watching us here on KXAN Live. We appreciate it. I'm Will Dupree. We'll see you back here another time. Please, everyone, stay safe, stay healthy, and take care.